Diagnosis of HIV or AIDS virus. Although the acquired immunodeficiency syndrome was detected in 1981, the identification of HIV as the causative agent of the disease did not occur until 1983. Began in 1985 for use in blood banks, the first laboratory test for HIV, developed by the research group of Robert Rooster. This test could detect if the blood contained antibodies against HIV. However, during the 4 to 8 weeks after exposure to HIV, the test is negative because the immune system has not yet developed antibodies to the virus. In general, the various laboratory tests used to detect infection by the human immunodeficiency virus can be classified into direct and indirect, as if trying to prove the presence of the virus or its constituents or the immune response by the host. The most widely used method is the study of antibodies in the serum. The Centers for Disease Control and Prevention in Atlanta have established the following definition for the diagnosis of AIDS in HIV-positive individuals. CD4 T cell count should be less than 200 cells per cubic millimeter of blood, or the individual must submit any clinical manifestation of AIDS defining opportunistic infections such as pneumocystis carinii pneumonia, oral candidiasis, pulmonary tuberculosis, invasive cervical carcinoma in women, among others. Knowledge of HIV transmission routes can take measures to prevent the spread of the virus in the population. In coital sex with subjects infected, the most effective method of prevention is the proper use of condoms. In cases of drug, must avoid sharing the material used for intravenous injection. To reduce the incidence of accidents transmission in healthcare workers is advisable to use instrumental, appropriate disposable as well as gloves and goggles. As for infected women of childbearing age, it is very important that they receive all available information regarding the possibility of transmitting HIV to the fetus, and therefore the advisability of adopting the necessary measures to avoid pregnancy. HIV transmission through breast milk breastfeeding contraindicated, so that artificial feeding is recommended. Many countries are performing successfully for some years great informative and educational campaigns that seek to change the risk behaviors associated with HIV transmission. From those purely informative concerning the modes of transmission of HIV and methods help it to programs in which needles and syringes to drug addicts are offered to prevent reuse.